Hi, this is my IV skills video, and before I do anything I would perform hand hygiene, and then I would take the solution and I'm going to double check that the solution matches the information on the patient's MAR, and I also compare the patient's ID band to the information in the MAR as well, and if everything is good and correlates I would create a label for the solution. Right, and I know it is important to maintain a sterile field while doing the IV and make sure not to contaminate this or the spike. So I'd carefully open up the sterile packaging and remove the gravity set. And before I insert this, I want to make sure the clamp is completely put all the way down. And then I'll remove the cap of this, making sure not to touch the outer portion. Now insert this in here. Okay, and now I'm going to want to hang the IV bag. And now I'm going to want to prime the tubing. And I'm going to start off by filling this chamber about halfway. Right. And make sure there's no air bubbles while making sure the fluid goes through every part. Okay. And inverting at the Y ports to make sure there's no air bubbles in there as well. Okay, now that the tubing has been primed, I can set up the drop rate for this, and it's 100 milliliters per hour, and so the drop rate for that would be 25 drops a minute. And to reduce that, I would divide it by 4, so it would be about 6 drops every 15 seconds. And I would set that up now, using slowly releasing the clamp so I could get it to the drop rate needed. Alright, this is a little too fast, I'm going to try to slow it down some. Alright, that was 6 drops in 15 seconds, would give it to about the 25 drop per minute. And now I'm going to spike the IV PB bag and hook this up as well, making sure I can hook it to this white port that's above the clamp. I'm going to use the same techniques as beginning, opening the spike set, keeping things sterile, making sure this clamp is all the way down before I start, making sure I don't touch the outer portion of this or the inner portion of this. Alright. this one here. And then I'm going to prime this as well. Making sure I first fill up this chamber about halfway with fluid. Right. Making sure there's no air bubbles along the way. So far so good. Okay. And then I will connect this to the port down here. Making sure not to touch this inner part. Just here. And then for the NS flush, I would assess the IV side. This would be connected to the IV, and I would put on some gloves. And I'd have to clamp the part of this that would be connected to the patient. And I would take one of these sterile alcohol prep pads and I would clean this. And then I would connect this here. And then I would administer the 2 to 3 milliliters of normal saline.